Hi, my name is Shah,
And I am Navya Saitala.
and today we will be presenting on coronary artery disease. I am a junior at Paradise Valley High School in Phoenix, Arizona. I'm currently part of a STEM program and am specifically interested in bioscience. I currently tutor kids at Kumon and am part of clubs such as NHS, HOSA, and more. I'm also vice president of my school's She's the First chapter. I have various volunteer and shadowing experience, and in the future, I plan to stay on the medical track, specifically pursuing cardiology, pediatrics, or surgery.
I am a senior attending Cypress Ranch High School in Cypress, Texas. I am a member of many clubs such as HOSA, FBLA, and Key Club, and participate in many activities such as iFeminist and Global Science and Medicine. I have multiple volunteering and tutoring experiences. In the future, I hope to earn a degree along the pre-medicine track, specifically in either bio or public health. Now, let's begin the presentation.
Let's start with global statistics. Ischemic heart disease, also known as coronary artery disease, is the leading cause of death globally, accounting for around 16% of deaths each year. As shown in the chart, CAD has had the biggest increase of deaths globally from 2000 to 2019. This shows how this is a pressing global issue. So let's dive into its causes.
We are here to explore coronary artery disease, also known as CAD or ischemic heart disease, and its prevalence and possible solutions such as nanotechnology and lifestyle factors. As seen on the slideshow, coronary artery disease is caused by the flow of blood and other nutrients being insufficient to sustain heart muscle due to atherosclerosis, which is also known as the buildup of plaque. This is often caused by multiple factors, such as unhealthy lifestyle choices, genetics, and high cholesterol. So, what role does cholesterol really play?
Well, there are two types of cholesterol: LDL, low-density lipoprotein, and HDL, high-density lipoprotein. HDL is known as good cholesterol, as it picks up any extra cholesterol and takes it to your liver, where it is then broken down and removed from your body. LDL is known as bad cholesterol because it takes cholesterol to your blood vessels. And even though it is typically used for cell repair, the excess starts to build up on the walls of arteries, leading to atherosclerosis. But how does this affect populations?
CAD does not affect every ethnic group equally. As seen by studies from the National Library of Medicine, South Asians have the highest rate of CAD at 24%, in comparison to their white counterparts, who have the lowest at 8%. In addition, both women and minorities are suffering from misdiagnosis or underrepresentation in regards to CAD, with women most likely being misdiagnosed due to different symptoms, and minorities being underrepresented in clinical trials for potential CAD solutions. So how can we diagnose or solve CAD?
Well, some current diagnosis methods include echocardiograms, which are an ultrasound of your heart, nuclear and exercise stress tests, heart CT scans, and angiograms. Some current solutions include cholesterol medications, coronary artery stents, which is a minimally invasive procedure, and coronary artery bypass surgery, which is a form of open heart surgery. But how can lifestyle changes play a role in this?
By following certain lifestyle changes, it can be essential in preventing or reducing the risk of CAD. To avert CAD, one should follow a healthy diet and workout regime, and avoid foods that are high in cholesterol, salt, and other processed foods. By following these changes and many more, you can reduce the risk of cardiovascular diseases in the future. Now, onto our new solution. CAD places the heart under severe stress. This can cause CAD-related biomarkers to be released into the bloodstream when the heart is damaged or distressed. Some biomarker examples are included on the slide below. So how does this relate to a new solution? Nanotechnology. Nanotechnology is the manipulation of atoms and molecules at the nanoscale level, using various devices, structures, and methods. These nanobots have a high surface area to volume ratio, making them more efficient and a good potential solution for the future. So let's delve in deeper.
So how does nanotechnology help with CAD? Well, currently mass spectrometry is being used to identify the potential biomarkers that were listed before. But this method is limited by sensitivity and specificity due to low plasma biomarker levels. Instead, nanotech biosensors can be used in the early diagnosis of CAD. This would include a biological sensing element, such as antibodies, which would use a high attraction and recognize target molecules. Once this is done, a transducer would be able to convert the gathered data into electrical signals to give us more information. This is currently ongoing research, but does show promise as a potential solution in the future. Nanotechnology is also used in drug delivery. To lower the risk of CAD, drugs such as statin may be prescribed. But studies have shown that systemic delivery of these drugs, meaning delivery throughout the entire body, can lead to severe issues, such as hepatotoxicity and myopathy. This led to the use of nanocarriers in drug delivery. Due to their ability to specifically target different sites, nanoparticles are synthesized to bind with specific cell receptors that tell them which sites to specifically target. Scientists were also able to combine reactive oxygen species, ROS, with responsive nanoparticles to fully cover a drug, such as atorvastatin, enabling it to safely get through a cell's safety system and properly target issues such as atherosclerosis. What can we take away from this?
Overall, we have thoroughly gone through what CAD is. We now know that CAD is the result of atherosclerosis, which is the buildup of plaque. We have learned that CAD does not affect everyone equally, whether it's in regards to diagnosis or treatments. Finally, we now know how CAD is diagnosed and what we can do to prevent or reduce the risk of coronary artery disease. While coronary artery disease currently has no cure, for the future, we can only hope that medicine makes it strides to alleviate the suffering of those with CAD. So join us in supporting the search for a cure to coronary artery disease.
Here are our references, and we would like to acknowledge the organizers of the Global Health Conference, Phoenix Heart, Johns Hopkins, and my teacher, Ms. Launderville, for providing us with resources and inspiration for this presentation. Thank you, and feel free to reach out with any questions.